Back now with some breaking news for our next story. Former President Bill Clinton has left a New York hospital this morning. His daughter Chelsea was with him when he did so. Mr. Clinton spent the night there after having 2 stents put into an artery. The former president went to the hospital yesterday after saying what he felt was chest discomfort. Now, 6 years ago, you'll remember, he had a quadruple bypass surgery to fix blocked arteries. Dr. Warren Levy, president of the cardiovascular group, joins us now to talk about the procedure that the president had. Good morning to you, Dr. Levy.
Good morning, Andrea.
First, let's talk about the group. You said you have 10 offices based out of Northern Virginia.
Sure. We cover all of the hospitals in Northern Virginia. We have offices all throughout Northern Virginia. And we see lots of patients like former President Clinton who've had procedures but need to come back sometime in the future for new procedures, because what we have to remember is that coronary artery disease is a lifelong disease. Although you may have bypass surgery, although you may have an angioplasty or a stent implanted, you still have coronary disease, and you have to be very vigilant to look for signs and symptoms of ongoing disease so that we can nip it in the bud like President Clinton's doctors did in New York.
I want to talk about what he had done and all that, but I will say I had to jump to something that I read that the president said. He said, "My life has changed." Since then, he finds that when he gets tired, he doesn't push himself. He just tries to relax, and he says he's eating better, he's exercising. So, but you're still not surprised that that this type of patient would be back in for follow-up procedures?
President Clinton has been a wonderful spokesperson. He could become the American Heart Association poster child, because he did change his evil ways. He did start exercising. He did adhere to a heart-healthy diet.
No more Big Macs.
That's right. He has been very good about taking medications that are important to lower your cholesterol and do the things that you can do to reduce your risk, but you can't reduce it to zero, because unfortunately the major risk factor that we can't change are our genes.
Right.
You're given those by your parents, and you get them lifelong, and we have to be very aggressive about reducing all the other risk factors that will reduce his risk of, and all patients' risk of, having recurrent disease.
So originally, what was that, back 6 years ago now, he had the quadruple coronary artery bypass. Now this time 2 stents put into an artery. Can you explain this for the person at home and myself right here who doesn't completely understand what that means?
Absolutely. Well, coronary disease is when you develop blockages inside the arteries that provide the blood to the heart muscle. Now, if that artery would close completely, all the heart muscle downstream dies, and that's a heart attack. When you just have tight blockages, you can get symptoms that we call angina, which are a heaviness or pressure, a squeezing sensation in the chest, which former President Clinton started having recently. Fortunately, went to see his doctors. They found that he had developed blockages, new blockages, either in his own arteries or perhaps in the grafts that had been put into his arteries. I don't know that that was made clear. But what we can do is we can actually go in there with a tiny little catheter through an artery in the leg, there's no surgery, and open up the blockage with a little inflatable balloon. And then what we often do is leave a little metallic stent, which is sort of a scaffolding type device, inside the artery to hold it open and to help in the healing process. It's a very simple procedure. It takes 40 minutes, 50 minutes.
Yeah.
And you go home a few hours later or the next day, and I think the former president probably already left the hospital.
He did. He walked out, he and his daughter, and I was going to ask you, is that unusual? But not these days.
Absolutely not. Back to work the next day, no rest for the weary, and maybe he just shouldn't exercise for 3 or 4 days, but no, he'll be fine. And they're doing all the right things. The important message for everyone out there, whether you have coronary disease, and especially for those who do have heart disease, is you're not cured when we do something. It's a lifelong process. We always need to be vigilant. We need to look for symptoms. We need to be very aggressive with risk factor modification, and that's probably true for everyone out there who has any risk factors at all.
Right. But I would not be surprised to see the former president being that spokesperson for the
Well, I think
American
it's great.
Heart
The more high-profile people we can get out there, and this is American Heart Month, by the way, and so maybe the timing is good, just to increase awareness. And I should mention that women sometimes have this false belief that they're immune, but more women die of heart disease.
1 in 3.
That's right. 450,000 American women died last year of heart disease.
Okay.
It's a big number.
We appreciate your insight into this. Dr. Warren Levy is with the cardiovascular group out of Northern Virginia, the president of the group. Thank you so much.
Thank you.
Okay.